Good afternoon, and thank you for joining us on H360 Live. My name is Dave Duplay, and alongside of me today is Cortland Long from Healthio360. Joining us in the studio today is Rebecca Palm from CoPatient. Thank you for coming down from Boston to see us.
Thank you for having me.
We have a very exciting show for you today, a lot to talk about, a lot of interesting articles and a few health tips that I think are timely and appropriate for the upcoming golf season. So let's jump right into it. We do have a new perk partner on Healthio360, and that perk is called Caring in Place. It's a very innovative mobile app. And Cortland, you want to share with us what Caring in Place does for people?
Yes, I would love to. So as many of our viewers and users know, Healthio360 is a caring community for patients with chronic conditions and their caregivers. So Caring in Place is a really exciting partnership where it's a desktop and mobile app for family members to learn to be caregivers together. And so what this app does is you can download the app on your phone, enter in the individual that you're going to be caregiving for, and then you can create intelligent checklists that you can coordinate with your other family caregivers and also professional caregivers as well.
Oh, professional caregivers.
Yes, professional caregivers. So you can also ask your professional caregivers, so nurses who come to the house or other services that you use, that they download the app as well and they be looped into the service. And so it has some really awesome features. You can create videos from the app of how to populate a pill box for someone who you're taking care of, and then you can check off on the app that you've completed the task, or you can say, I'm going to do that, and so everybody knows that you're going to take care of something.
Yeah. I downloaded the app not long ago, and it really is very intuitive and very helpful. My mother has Alzheimer's disease, and so as a family, we're kind of spread out all across the country with my one sister close to my parents. But this app really allows us to see what's going on and how often people are calling and coming in and sending them things that they need. So it's a wonderful app and a wonderful little company and a wonderful perk, and we're happy to have them as a partner.
Yeah, and one other extraordinarily helpful thing is that this app also populates reports that you can bring to the doctor. So when you go with your family member who you're caregiving for, or your caregiver goes with them, you can show the doctor, the steps that you're taking to help this person, and also, their blood pressure and the medications that they're taking, and when and what times, and also what they're eating. So it's very helpful.
Fantastic. That's great. That's great news.
Very cool.
So I want to talk a little bit about our first health tip. And it's 5 steps to prevent cavities in kids that go and extend beyond brushing and flossing. Did you know about this?
Well, I know a little bit about it.
About brushing and flossing?
It's very important.
It's important, yes.
I take crazy good care of my teeth. You only get, one set of adult teeth in your lifetime, so I'm really crazy about it.
Yeah. So what are some of those things that we can do? What are the 5 tips?
Well, it can be difficult to get young children to brush and floss their teeth. So some tips that you can use, and this one I hear about a lot, is to never share utensils with your children, and don't put your child's pacifier in your mouth to clean it. Both of these can transmit germs that can go to your child's mouth and create cavities.
I can't tell you how many times I see a pacifier or a binky, right, that falls on the ground, and the parent puts it in their mouth and cleans it up and pops it back in the kid's mouth, especially if they're throwing a fit in the grocery store line, and they want to get them quiet quickly. And you can usually tell that that's the second child, because on the first child, the pacifier gets sterilized, and and you have 5 or 6
cleaning
of them
ritual.
all. A little cleaning ritual. By the time the second one comes along, it falls on the floor, and here you go, right? So what are some of the other tips?
So another one, and I'm a fan of this one because it's a major public health initiative, is to make sure that your child eats a nutritious diet and drinks plenty of fluids and water that contain fluoride. So a lot of people maybe might not know that the public water supply is already fluoridated water. So this is a very easy tip to take care of and check it off your list, because if you are giving your child tap water, it already has fluoride, and many bottles of water have fluoride too.
Yeah. And, you know, I think there's a large push in the schools as well about more nutritional meals, right? I've read that somewhere that, you know, I think they're getting away, you know, from the less or the more fatty food and getting more healthy and, you know, health conscious in the cafeteria line as well. So that plays into it. What are a couple of the other things that we need to focus on?
So another one is, I believe children first start teething around 6 months of age. So it's important to schedule your child's first dental visit no later than age 1. So it's important to get your child to the dentist early and every year.
Cool. Anything else?
Brush your child's teeth at least twice a day for 2 minutes a day. That one might be a little tricky. You might have to chase your kid around the house with a toothbrush, but get it done. And talk to your dentist about applying a sealant to your child's teeth in advance of cavities.
Yeah, I didn't know about the sealant. The 2 times a day brushing, I think that's the rule of thumb for adults as well.
Right.
Yeah, I've got one of these electric toothbrushes and it works fantastic.
They even have
Sonicare,
timers on them themselves, right?
Yeah. Oh yeah. Yeah, you
Make sure you get to the 2 minutes.
Yes, exactly. It goes by quick. It gets your gums. It's fantastic. But so a little health quiz. Do you know how often does a dentist recommend that you replace your toothbrush? How often would you think? If you brush twice a day.
I think 3 months.
Very good. Were you looking at my notes here on the table? It is 3 months.
My eyesight's not that good.
And there's no need to lose sleep over bacteria on the head of the toothbrush. So you don't have to throw away your toothbrush if you're sick, because the germs from being sick won't survive in a dry environment. So you didn't know that, did you?
I did not know that.
That is a good tip. You don't have to throw that toothbrush away. Just make sure that the brush is upright and it gets good airflow, and you're going to be all set.
All right, fantastic.
Yeah, very good. Did you guys know that April is National Autism Awareness Month? And we're going to talk about what I think are some staggering numbers here around childhood autism. Do you want to share some of that with us, Cortland?
Yes, I would. So about 1% of the world population has autism spectrum disorder. And the prevalence in the U.S. is estimated to be about 1 in 68 births. There are more than 3 million Americans who live with autism. I mean, these are some pretty staggering figures. And, you know, we can go on to say that autism is the fastest growing developmental disability.
Wow. I didn't even realize that. That's something.
Yeah.
I think it's grown like 119%, right?
It has.
From 2000? Those numbers are just staggering to me.
Yeah, it really is. But there are some things that you can look out for to bring your child in for screening if you are suspecting autism. And some of them are that your child is not hitting certain milestones, like not babbling by 12 months of age, not gesturing by 12 months of age, or using single words by 16 months. And so to become more involved in autism awareness, there are many fun runs and 5Ks happening around the country in support of autism awareness. So, you can find one in your local area and get involved and learn more about autism.
Yeah, one of my favorite golfers, Ernie Els, is a very big supporter of autism. I think he has a child who is autistic, and he has a golf tournament every year, and it's fantastic the work that he does and the money that he raises for autism. So good stuff. So get out and find a walk and support autism and the fundraisers. Go online and check your area and see if there's something you can participate in.
Yeah. And speaking of golf, Dave, I know you're a big golfer. I think you might have some health tips for us about golf.
I do have a few health tips around golf, and it's appropriate because it's the season. And Rebecca, I think your husband's a golfer, right?
He is. And so I'm constantly having to remind him of some of these tips. So I'm excited to share the video with him. Brad.
So Brad, if you're watching, pay attention to this because we're talking at you, buddy. We want you around for a long time. But yeah, it's some basic health tips that, I think most golfers, including myself, sometimes forget. And the first health tip is to perform some basic stretching. If you really think about, what you're putting your body through in the golf swing, especially on the driver when, you're up there and you're with your friends and you want to, really get it out there a long way,
Sure.
you're torquing your body and your upper body and your torso. And so doing some basic stretching, some leg stretching, some arm stretching before you hit that first tee is going to really prevent some injuries from occurring. So get out there, stretch those shoulders and stretch those legs before you tee it up. Protect yourself from the sun, right? Sunscreen, sunglasses, and a brimmed hat, right?
Oh,
Does your
Dave,
husband
this
wear
one
a
is
hat?
for Brad.
Brad, this is for you.
I'm constantly bugging him, chasing after him with the sunscreen. So this one is for you, Brad.
Yeah. No, you got to do that, and because it's so important, right? I mean, most golfers are out there in short sleeves and. And you're out there in the heat of the day, and if you're spending most of your time in the sand trap where it's really warm, so you do get burned very easy. So you gotta wear the sunscreen. The next one is drink plenty of fluids before, after, and during your round of golf, and whenever you're feeling thirsty. And I'm not talking about the adult beverages. I mean, you have to drink the Gatorade and you have to drink the water and really stay hydrated because it does get hot out there. And the last one, although it might seem a little silly, I think there's quite a few accidents around this. It's, keep your feet in the cart at all times. And I don't know if it's golfers, anxious to get to their next shot and they get out and the cart's still moving and ankles get sprained, but nothing good happens when you keep your feet outside of the cart and it's moving. I can guarantee you that.
Words to live by.
Words to live by. And just one more, I forgot about it, but I am going to mention it. Be aware of other players on the course. I don't know if you've ever gotten struck by a golf ball, but it's not a pleasant feeling. And so, be aware of your surroundings and always pay attention to what's going on and be aware of the other golfers that are coming and going around you.
Is there a warning call that you're supposed to yell before you hit someone with a golf ball?
Well, yes, there is, and you yell 4. Okay. I don't know why it's not 3 or 5, it's 4. But when you see that you've hit a shot and you're driving into somebody or the ball's going towards somebody, the courtesy is to yell so that those golfers could, cover their head and be prepared for, what could be a disaster on the course. So how did you know about that? I'm very impressed, Cortland. That's good. That's good. So moving along, there's an interesting article that we read that we want to share with our viewers about a woman who was suffering from cancer, and her family got removed off an airplane. But it does, although we'll talk about the story, it does have a very happy ending. So Cortland, what happened to this woman and this family that they were asked to get off the plane and they couldn't take the flight? Yeah,
it's unfortunate, but Elizabeth Sedway and her family, they were boarding an Alaskan Airlines flight from Hawaii to go back to California. And Elizabeth was seated in a handicapped area. She was asked by a flight attendant if she needed any assistance to board the flight. And she said, no, but I might need a little extra time. I sometimes feel a little weak. I get a little winded. And so as she's boarding, she's wearing a surgical mask to protect her from other germs and things like that you need to be cautious of when you're going through cancer treatment. And she was unfortunately evicted from the plane. So a stewardess came on to the plane and asked her to get off. They said she couldn't fly without a doctor's note. And so Elizabeth shared, I believe it was a video where she was saying that her family is being forcibly ejected from the plane because she has cancer. And it's unfortunate. The airline did refund their money and they paid for her family to stay an extra night in Hawaii. And Elizabeth, she has a really fantastic quote in this whole story, and she says, "As with most unpleasant times, there are silver linings if we're determined to find them. Here, we plan to donate the airfare to be refunded by Alaska Airlines to the Multiple Myeloma Research Foundation." And this cause, I think, is very important to Elizabeth because she's been suffering from multiple myeloma for 5 years.
Yeah, and what a wonderful story and a wonderful ending, but could you imagine you're asked to
in that moment.
In that moment, right? And you just want to get home, and this happens. But the Multiple Myeloma Research Foundation is in itself a wonderful organization. I think it's founded by a woman named Kathy Giusti, who is a multiple myeloma survivor, and she started this wonderful foundation that's really on the innovative edge of collaboration with other foundations to look at gene sequencing and to find a cure for all types of cancers. So what a wonderful way to end that story.
Yeah, I'm sure they'll make good use of the exposure, so
yeah,
I'm glad that they'll benefit from that.
Yeah, absolutely. So, Rebecca, thanks for coming down from Boston today. I was hoping to have better weather. We were wondering if the storm that's supposed to be blowing in was going to delay you a little bit, but it didn't, and I am so glad you're here because you have such an innovative company, and I'm happy to have you here. But before we get started, I want to play a video clip from ABC News and Diane Sawyer where she talks about medical bills and understanding medical bills, and actually features CoPatient in that clip. So with that, let's roll the video, and then we'll come back and chat with you.
Great.
And next tonight, our Real Money team is back on the trail of outrageous medical bills. Medical bills are the #1 cause of personal bankruptcy in this country. So ABC's Rebecca Jarvis shows you what happened to one family putting thousands of dollars back in their pocket and how you can do it too.
While 2-year-old Rowan sifts through his blocks, his parents, James and Sarah Haug from San Antonio, Texas, are still sifting through a mountain of medical bills for Rowan's delivery.
We owe a little over $50,000.
$50,000.
Right.
For childbirth. Yeah. So we brought in our healthcare consumer advocate, Michelle Katz, to try to cut down that bill.
Hi.
Step 1, ask for an itemized bill and a copy of your medical records. Compare the two and contest any service you don't remember getting. It might be a billing error. And comparison shop, even after the fact.
Call up your hospital and say, excuse me, but the guy down the street is charging 80% less.
Right. And that's unfortunately the way you have to think about it. It's just like going into a car dealership.
Doing that, the Haugs found out they were being charged 4 times the national average for a C-section delivery, and were able to negotiate a whopping $12,000 off their bill. To catch extra savings you might have missed, consider hiring a professional medical bill negotiator like CoPatient. They keep 30% of whatever savings they get you. You keep the rest.
We're seeing some sort of error or overcharge in 80 to 85% of the bills that we review.
Almost all of them.
Almost all of them, yeah.
They're using advanced computer programs to ferret out billing errors.
They build it in such a way to say that Rowan was sick at delivery and that he needed special attention. That wasn't the case. And that's a $17,000 charge.
They'll even help you apply for special grants and discount programs. And we were there as Helena from CoPatient told them just how much money she saved.
I have saved James and Sarah $18,000 today.
$18,000 so far. That's $30,000 in total. The moment stunned us all.
Wow.
Wow.
That's good news.
What does this mean for your lives?
Just means we can move on.
Unbelievable. They fought that bill for more than 2 years, but the message here tonight, never give up. They called in that billing advocate. There is a cost to doing so, but she really turned things around. And even if you don't hire help, there are things that you can do on your own, and we have put those tips, Diane, those tried and true methods, because we've seen this now so many times. We've put them on our website, abcnews.com.
And this is what you can do on your own.
Fight it on your own.
Okay, thanks so much, Rebecca. Great.
So what an interesting video. And what an interesting company. And I'm so anxious to hear, as the co-founder, how you came up with this innovative idea and, what did you go through to make this all happen and bring this wonderful solution to people?
Oh, well, Dave, thank you so much for having me. I'm really excited to be here and working with such a wonderful company. We're really excited to tell our story to all of your viewers and audience members. I worked with a friend of mine at a previous company that did a lot of work helping doctors to bill insurance companies for the services that they were delivering. And one of the frustrations or challenges that they were seeing was with increased deductibles and increased cost sharing with consumers. They were having a lot of trouble understanding why consumers weren't paying them for their medical bills. And so when we started doing research on that problem, we talked to a ton of medical billing offices and we talked to a ton of consumers to say, what's really going on here? Because most providers in healthcare were only collecting about 15 cents on the dollar of what they were owed by consumers. And so we thought, there must be something larger at play here than just, a billing issue. And we found that that was absolutely true. So as we started interviewing consumers and as we started trying to get at what the root causes were of why they weren't paying medical bills, we found a staggering amount of confusion and skepticism on the part of consumers. So a partner of ours just released a statistic that nearly 2/3 of consumers don't trust the medical bills that are sent to them. And really, a lot of the result of that is because of the way that our healthcare gets delivered. So there may be 5, 6, 7 different companies involved in delivering the care that you receive, even if you perceive it as one episode or one instance. So for example, an ER visit may spawn 5 or 6 different bills, even though you feel like you only went to one facility. Right. And so when consumers start getting that mountain of paperwork coming in the mail, between the billing for all those different providers, plus all the things that look very confusing, that we all know this phrase, this is not a bill. And they look a lot like bills. So consumers were having a lot of trouble just trying to make sense of it all. Am I being billed fairly, accurately? Should I pay what I think I should pay out of the paperwork that's coming in the door? What is actually going on here? This is more than I expected to be billed. I don't really understand my benefits. And I have a lot of confusion over what I should pay and when. And so when we saw that as the root cause for all of these consumers, we thought, wow, there really deserves to be a solution for consumers to understand what they're being charged. The medical billing system, when it comes to the bills that consumers receive, unfortunately is really opaque and confusing. The complexity of all the codes and the language that's used in medical bills is virtually impossible for the layperson to pick up quickly and easily and become effective on their own behalf quickly.
I want to stop you for a minute because I have a couple of medical bills here in front of me.
Oh, good. Well, hopefully they're not yours.
Well, they're not mine. They're not mine, but they are real bills. And I'm with you on what you're saying, because I'm just looking at these bills and it's amazing. I see a lot of codes. I don't know what these codes are for. 121, 300, 320. And then we have some descriptions, Med, Sur, GY/2-bed. Okay, 2-bed. I'm one patient. I don't know what 2-bed, what that means.
Plain English, right?
For plain English, for a pretty large number here. Then we have drugs, generic. Then we have drugs not generic. And then I see pharmacy drugs. And so I don't know what I'm looking at here. It doesn't make a lot of sense to me. And then if I look at my second bill, it would appear on the surface as though I'm being double charged, because I see 2 line items exactly the same that say pin hand dislocation for $2,600 and change. And so right away I'm confused, and they've got amounts, and this doesn't say this is not a bill. I think they're expecting me to pay the $21,000 here.
Right.
So it is confusing, but so what is one to do now? So you've started this company, and so what is it you do? How do you work with the consumer? How can we get our members and our audience educated so they can start working with you? And how do they work with you? How does one engage with your company?
Well, and I'll bet you these bills probably didn't all come in at the same time. Exactly. I'm sure you probably got one in a week or 2 after your visit, and then another bill or an explanation of benefits 2 or 3 months later.
Yeah.
that visit's totally forgotten from your mind.
Yeah.
Right, right.
Yeah.
Or even longer. So you bring up a really good point in that the timing of the billing is equally confusing and frustrating to consumers. So as you saw in the ABC clip, one of the problems for this family was that that child whose bills from being born is now a toddler. We're still continuing to plague that family 2 years later. And so they had tried to resolve it. One interesting tidbit about that family is that the father of that baby was actually a resident. So he's a doctor. And even he couldn't understand the crazy world of medical billing. So it is really difficult because so much of what goes into a medical bill is, number one, knowledge of the coding, the revenue codes, the CPT codes, the diagnosis-related groupings, all those different methods that providers can use to bill for the procedures that they perform. And a lot of the descriptions as well as the codes have to do with things that as a consumer you might not necessarily know up front. So what is the place of service, the setting? Are you actually in an inpatient hospital room, or are you in an outpatient observation room, both of which have the same beds and the same staff and the same building? You know, so it can be very confusing to try and decipher all this. And that's really the inspiration behind CoPatient and what we do for consumers is we try to, number one, help them decipher, have I been billed fairly and accurately? So we provide a free upfront analysis to the consumer of everything that they're getting billed for to understand if there are any opportunities for that individual to save on that set of bills. So it might be a coding error. It might be an erroneous charge for something that the consumer didn't receive. It might be just a simple price negotiation if it's a situation where the consumer's health plan didn't have a contract with one of the providers that's billing. So there are just any number of ways in which medical billing can go wrong for individuals, and we'll provide them with that information and that insight up front on whether they've actually been overcharged or whether they have opportunities to reduce what they owe. So then the consumer has the choice of if they want to opt in to have one of our experts help them resolve whatever the issue is that's been identified.
Right? I think you call them patient advocates.
Exactly, exactly. And so the challenge for consumers trying to resolve it on their own, as you saw with the Haugs, they tried for 2 years, is that they often don't know the right language to use, the right department in the hospital to call, or how to navigate all of these complexities on their own. And so this is really where the CoPatient advocate can act on their behalf and can use their expertise to apply to that consumer's case and help them through those things that would be really difficult for a consumer to figure out on their own. So our advocates really act as the consumer's partner or ally in resolving these things. So having the consumer themselves involved is really important, in making sure that we're getting the true story of all the services that got billed and whether they were delivered or not. And in addition, just making sure that we're using that process to help the consumer to be a better consumer of healthcare and make better decisions, understand, where their situation might have gone wrong, so that they can use that knowledge and, armed with that knowledge, make some more effective decisions next time.
Yeah. So I come to your site and I log in and I create a free profile, right? And you gather some information from me, and then whether it be scanned and emailed or sent to you through the regular mail, you receive my bills, and you have an expert patient advocate in your office, and they go through those bills. Now, I understand that you've got a pretty sophisticated set of algorithms behind your technology, right? And so you put the bills in there, and so it's beginning to look for things that maybe, a human might not pick up, right?
Absolutely, absolutely. And that's really what's very different about CoPatient, is that we bring that technology to bear on behalf of the consumer. Typically, they haven't had a lot of options in the past. If they were lucky enough to know somebody who was a former coder or a nurse or somebody like that who could help them, then they were able to use that resource. But if they didn't know anybody firsthand or didn't know the right questions to ask, oftentimes they were left without any resources. So our technology platform does a couple of things. As you mentioned, there's a lot of built-in intelligence so that we know when the consumer's data comes in, what the situation is and what we might want to look at in terms of potential billing hotspots, so patterns that we see, as well as providers that we see on a repeated basis that might be, for example, making the same billing error on a regular basis, so that we can identify and flag those things up front. Secondly, the technology platform really acts as a connector. So these advocates that are out there that are working so hard and so passionately on behalf of consumers have had a hard time being found by the consumers that need their particular expertise. So for somebody who worked in hematology oncology billing for many years, for a patient who is facing cancer treatment, to be able to be connected with them so that they understand all the nuances of that specialized type of billing is equally important. And so our platform brings together those types of specialized resources and matches them with those consumers that are best suited to their expertise as well.
Yeah.
So are your advocates prior medical billers and coders? Is that where their expertise is coming from?
They come from a variety of different backgrounds, and our advocates are such a powerful force to be reckoned with. They are really effective. And their diversity of backgrounds is really one of the biggest assets that we have. So our advocates include folks who are former clinicians, so radiology technicians, registered nurses, folks who come from that walk of life, as well as people who have billing and coding backgrounds and who may have worked in, in a hospital or physician setting before. And additionally, we've even brought on some advocates that come from a completely different walk of life, so perhaps they have been clinical advocates before or patient navigators, and what we do is just one aspect of their expertise. So there are a lot of different backgrounds that can make somebody appropriate to be a co-patient medical billing advocate and work on behalf of our consumers.
Yeah, we've had a couple of patient advocates in recently, and to hear their story and what they do, and both of these gentlemen are both cancer survivors, and they now walk the journey with other patients who are newly diagnosed. So you're coming at advocacy from a whole different angle, which I think is fantastic. On the average, how much do you save people?
So on average, we save consumers about 40% of what they initially owe when they come to us. And it's really powerful because, as you mentioned, the two examples of cancer survivors who got involved in advocacy, unfortunately these bills tend to roll in, particularly for those with more serious illnesses, at a time where they are so stressed out and overwhelmed.
Totally.
They're trying to recover from whatever illness they have, or still undergoing treatment, which leaves them weakened or in a more fragile state in general. And so what we find is that we often reach consumers at kind of the low point of when they're really experiencing so much stress. People with cancer are about 50% more likely to declare bankruptcy than the typical citizen in the U.S. So the statistics in terms of the implication that it has on the rest of their lives, not just their health, are really dire. And so we get very excited about being able to bring something to them that will hopefully relieve a lot of that stress, first of all, personally and emotionally, and certainly in the end financially. So that's a really big part of our mission and why we do what we do.
Yeah.
So you were just speaking about large medical bills for people with serious conditions such as cancer. But if someone just goes to the doctor for a flu visit or a broken arm, maybe not a huge medical event, do you also handle bills for something like that, or is there a minimum bill that you handle?
We do. What we find, though, is that for a typical office visit with your doctor, there's usually not too much that goes wrong with that billing. You know, they're kind of billing the same codes over and over for a straightforward visit like that. So we don't typically find a lot of opportunities for the consumer to save in those instances. You know, where we are more successful and where consumers certainly should have us as an expert second set of eyes on their bills is for those more complex, more expensive things. So, you know, for example, a high complexity ER visit, an inpatient stay, a costly course of treatment, you know, an outpatient surgery. All of those are scenarios that tend to be much more complex to bill for, and therefore more opportunity for things to go wrong on the consumer's behalf.
So let me step back for a minute. And I've been in healthcare my entire career, and I'm very proud to say that. But you know, when you make big purchases, when you buy a house or you go and you buy a car, you negotiate, right? You look at the car and you shop around, and sometimes healthcare doesn't work that way, right? Where you know, you find yourself in a tragic accident, you're in an ambulance, and you end up in an ER somewhere. That doesn't happen. But for scheduled things, like say someone had to get their hip replaced, and there was a surgery, and then there was physical therapy. Does CoPatient also help negotiate scheduled procedures and negotiate the terms of what I'm going to get billed, or am I just surprised when the bill shows up and it is what it is?
Well, usually the first time consumers find us is in the latter scenario where they've gotten a little bit of sticker shock from the bills rolling in. But we do also offer that prospective type of negotiation service, so that is something that consumers can come to us for. And certainly something that our advocates are equipped to deal with, because it's a really smart idea to know what those costs are going to be up front. We've also had many cases, though, of consumers that tried to do the right thing. They tried to shop for their procedure up front and know what the cost was going to be. And unfortunately, at the end of the process, the bill that they got was quite different from the estimate that they had received beforehand. So that's another scenario where, as a consumer, that should raise a little alert in your mind that you might want to have somebody take a look at that bill.
Yeah, wow. So just a couple other points I want to make. So not every hospital visit has a happy ending, as we all know. And so when we lose a loved one, and then we're going through this very sensitive period of time, we're grieving, and then bills come rolling in. And so it may take, depending on the relationship, it may take some time. It may take 6 months, a year. It may take more. And these bills are piling up. Can somebody send bills of somebody that's passed away, and maybe the bills are a couple of years old or a year old when they're finally now getting their life back together, and then now they have to deal with this?
Absolutely. So Dave, you bring up two really good points with that question. The first is the age of the bills. So we can take bills that are any age. The most difficult bills, though, for us to work with are those that are already paid. So we encourage people to send those in to us before they pay them, so that we can make sure that they're not already out of pocket some dollars that they shouldn't have spent. The second great point there is when you have lost a loved one, and oftentimes in that end of life situation, they can incur some really substantial medical bills, and we've worked with a lot of cases where that's been the situation. The unfortunate part is that once that person does unfortunately pass away, the family that's left behind only has limited knowledge of what the billing situation is, and in many cases, the hospital can be pretty aggressive about trying to collect in those situations. In fact, we've seen hospitals where one of the first actions they take when they have a deceased patient is to sue the estate for the balance that's owed to the hospital. So we encourage consumers to not be intimidated by that, but to kind of take the bull by the horns, so to speak, be proactive in protecting that person's estate. and make sure that you review those medical bills carefully to make sure that they can't be reduced in some way, that the insurance has been billed appropriately and processed it all appropriately, and that there aren't any remaining opportunities to reduce those bills before having the estate pay them out. And with estates, there is a fixed amount of time to do that, so you want to definitely be proactive and do that quickly as soon as those bills come in.
Yeah, good point. Good
that
point.
brings up another question. Estates have a fixed amount of time. People are getting bills that say, you know, this bill is going to be sent to collections if you don't pay in X amount of days. So how long is the turnaround time of your service?
So typically when we get a set of consumer bills in, we will issue our initial report to that consumer of our summary of their situation within 2 to 5 business days. So we will get that back to them really quickly so that they can take action. One of the things that we also always share with consumers who are visiting our site or thinking about using our service is that it's a really good idea, if you have been billed by a provider, to let them know if you're going to get a medical bill review. So to just tell them, hey, don't send that to collections, I just want to do a review and make sure that I'm paying fairly and accurately for the services. And that will oftentimes help the provider to know what's going on. It's certainly better than, you know, lack of communication or radio silence, because that in many cases can get you sent to collections. So make sure you fill the provider in, let them know to put that account on hold and not send it to collections.
Yeah, great point. And great discussion. Yeah, I'm a fan.
Great.
You guys are doing some great things up there, so
as are you. So
I'm
we're
glad
excited to be
here.
working together, and so excited that we're going to be rolling out a joint community soon to help consumers that are visiting your site talk about and get some answers to some of their medical billing questions.
Absolutely.
So we're very excited about that.
So stay tuned for that. I do have some swag here for you. No one gets away from the show without some swag. Our Healthy O360 wristbands, and I am going to provide you with many more so you can take them back and share them with the office.
Beautiful. We'll give them to our team. We'll wear them proudly.
Yeah.
And we have a couple things for you, too.
Oh, wonderful.
We have our little co-patient advocate here, Bertina.
This looks like my grandmother.
She's also a stress ball.
Short and round.
So anytime those medical bills are stressing you out, Bertina's always there for you.
Very good.
And a mood cup, a co-patient mood cup. So if you put some cold water in there, it turns orange.
Get out.
So,
really?
Yeah.
Oh, I love it. That's fantastic.
So it's a little bit of a fun thing to go along with the with your regular office water.
Yeah.
Perfect.
Well,
It'll match our studio perfectly as well.
Yeah.
Exactly.
Yeah,
exactly.
the orange color.
Yeah.
Very good. Well, that's our show for this week. I want to thank you, Rebecca, once again for coming in. It's been our pleasure. I'd like to thank the viewership and members at home for tuning in. As always, you can find us on Facebook, Instagram, Twitter, and Pinterest. And please don't forget to use the hashtag RealStories when posting. Remember, all of our episodes can be found video on demand at healthyo360.com. So on behalf of Cortland Long and my guest, I want to thank everyone for joining us, and we look forward to seeing you again next week.
The views and opinions expressed in this broadcast are those solely of the Healthy O360 hosts and our guests for this broadcast. These views and opinions do not in any way reflect the views and opinions of our sponsors, advertisers, or other organizations on Healthy O360, including our community members.